FactsVerse presents. After a dying 80-year-old was told to pee in a bag, her doctor discovered the devastating truth. Dr. Marco Deplano is a 37-year-old urology surgeon based in Cagliari, which is one of the Italian islands of Sardinia. He graduated from the University of Cagliari and graduated in 2010. He'd been working at the hospital since completing his schooling, and he'd worked with plenty of patients during his career, but there was one patient who touched him more than the rest. Mr. Marco's day started out like every other day. He was working in the urology department when he received a call from another department, and that would happen often, so he'd head over to see the other doctor for a consult. The other doctor needed some advice about a patient who was suffering from terminal cancer. Her kidneys were failing. The woman he went to see was around 80 years old and she was extremely pale. She had carrot-colored hair that was only a couple inches long. He noticed that despite her weary appearance, her nails were pink and perfectly manicured. Dr. Marco examined the woman and then took a look at her file. When Dr. Marco looked at the woman's scans, he discovered that her kidneys were failing because her ureters were compressed. Ureters are tubes that connect the kidneys to the bladder to expel urine from the body when you urinate. They play an essential role in your body function, and this woman's ureters were blocked entirely. There was no way for her to expel her body's waste. Dr. Marco told the woman that he'd need to insert a catheter to help expel her urine. He told the woman that he'd insert a small tube to help her urinate correctly. He told her that she would need a procedure called a nephrostomy. The procedure would create an opening in her skin to lead to the kidneys. The tube would bypass the ureters and the urine would pass through the tube and into a bag. Dr. Marco explained to the woman that it's safe and it's a routine procedure, but there is a slight risk of infection or hemorrhage. While Dr. Marco was explaining the procedure, she interrupted him. She asked him if she'd also need a tube in her rear, and the doctor said yes. Well, that's when the conversation took a turn. She smiled at Dr. Marco, called him by name, and asked if he could spare a couple minutes so that he could understand how she felt. Dr. Marco was impressed by the woman's warm nature and he granted her wish. He asked her what was on her mind, and what she told him shocked him. Later, he said that she gave him one of the most touching life lessons. The woman told Dr. Marco that she had died 15 years earlier. The doctor was confused at first, but she explained what she meant. 15 years earlier, her son died from a heart attack. She said that the day he died, she died as well. She told Dr. Marco that when she was diagnosed with cancer 10 years earlier, she died again. She told him that she'd been living with heartbreak for all these years, but now, with her kidneys failing, it was the last straw. She said she knew she was dying and it was actually a relief. She didn't have to pretend for others anymore. She told Dr. Marco that her children and grandchildren were all grown up and doing well. She was ready to reunite with her son that she'd lost 15 years earlier. This is when she told Dr. Marco that she had made a decision. The woman told Dr. Marco that if she had the choice between peeing in a bag and being in pain or dying with dignity, she would choose the latter. She asked the doctor if he'd be offended if she chose not to fight. The doctor explained the procedure to the woman one more time and she chose to forego treatment. Instead, she wanted to go home and eat ice cream with her grandson and live out the rest of her days surrounded by family. Dr. Marco says that he was moved to tears by this patient, which doesn't happen often to him. He knows how to distance himself from personal feelings, but in this case he just found it impossible. He found this woman to be brave and strong-willed. When Dr. Marco went home, he posted the woman's story on Facebook. He didn't use any names, he just described the situation and how it touched him so deeply. The post quickly went viral, and it was shared over 100,000 times. It received over 156,000 reactions, over 2,800 comments. It seemed the woman's story had touched many people the way it touched Dr. Marco. Subscribe for more.